Traumatic brain injury. $160,000 Canadians get brain injuries every year.
30% of all TBIs occur in children, mainly in sports and recreational activities.
Approximately 1.5 million Canadians in Canada are living with a brain injury.
It is estimated that more than 50% of concussions are never reported.
Traumatic brain injuries are caused by bumps, blows, or jolts to the brain, which can disrupt normal brain functions.
People have been suffering with traumatic brain injury since the beginning of time. Throughout history, there have been examinations of skulls from battlefields in which a hole was drilled through the skull using a trepanning tool in hopes to relieve some physical relief for the injured soldier. This tool continued to be a part of the medieval and Renaissance period for surgeons in practice for many years. Thankfully, this procedure was replaced in the 20th century by brain surgery, and today has advanced immensely with the use of MRIs, therapies, and preventative solutions.
The frontal lobe is located under the forehead in the anterior part of the brain. Its functions involve arousal, executive functioning and judgment, emotional response and stability, language usage, personality, word associations and meanings, as well as memory for habits and motor activities. Some impairments to this region caused by a head injury could result in difficulties in planning and completing complex tasks, perseveration, loss of spontaneity interacting with others, possible speech and language usage issues, as well as loss of simple movements of various body parts.
The parietal lobe is located near the back and the top of the head. It functions with visual perception, tactile or touch perception, object manipulation, integration of sensory information, and goal-directed voluntary movements. Injuries to this lobe can cause things such as difficulty naming objects, difficulty writing words, an inability to attend to more than one object at a time, inability to focus on visual stimuli, problems with reading, poor hand-eye coordination, poor visual perception, and a lack of awareness of certain body parts in their surrounding space, also known as apraxia.
The temporal lobe is located at the side of the head above the ears. The functions may include the auditory perception and long-term memory. A head injury to this area may cause difficulty remembering names and faces, difficulty understanding spoken words, difficulty with identification and verbalization about objects, and difficulty with concentration. Other effects may include memory loss, aggressive behavior, difficulty locating objects in environment, and seizure disorders.
The occipital lobe is located at the back of the head. The function of this lobe is the visual perception. Some impairments caused by brain injury are visual defects, difficulty recognizing colors, hallucinations, and loss of academic skills such as reading and writing.
The main mechanisms for brain damage include focal brain damage, which means damage to a very specific area. This can happen from contact injuries and can lead to lacerations, contusions, and intracranial hemorrhages. And diffuse brain damage, which occurs in a more widespread area. This is due to acceleration/deceleration injuries, but not kind of blow to the heads. It's more of the skull, the brain moving back and forth within the skull. An example of this is shaken baby syndrome. This can lead to diffuse axonal injury, which is when the axons are sheared as tissues slide over other tissues, and brain swelling. The main outcomes of brain injuries, so you have the primary insult, which are the damages that happen at the moment of the impact. Prevention is the best kind of treatment, is the most sensitive treatment to this, as therapeutic treatments are not very effective. Then we have the secondary insult, which is the non-mechanical damage, and it are things and processes that happen that are initiated at the time of injury but happen after. These include cerebral ischemia, intracranial hypertension, and these are the injuries that are sensitive to therapeutic treatments.
Neurochemical changes. A nerve impulse activity occurs when a neural response in the brain fires a signal to a desired part of the body, for instance, your bicep muscle. This is a series of membrane potentials that are altered, resulting in a muscle contraction response. A TBI can induce temporary disruptions in a cell membrane that will redistribute the ions and neurotransmitters responsible for the activity involved in this nerve impulse. The membrane potential must reach an ion charge equilibrium again before the brain cells can fire another nerve impulse. Also commonly observed is the increase of intracellular calcium, which will induce mitochondrial uptake, and the overconsumption of calcium in the mitochondria will lead to a decreased mitochondrial function and oxidative stress of the cell.
Some of the stages of pathophysiology. So, right when the injury occurs, this direct tissue damage leads to an impaired regulation of cerebral blood flow, which is the blood that flows through the blood-brain barrier into the brain, and metabolism within the cells. So impaired cellular metabolism due to a decreased cerebral blood flow will lead to anaerobic glycolysis, which has a decreased ATP output and an increased synthesis of lactic acid. The increase in lactic acid will have an effect on the cell membrane permeability, which will allow things that shouldn't be into the cell in or out, as well as swelling of the cell. So because of this, the cell cannot maintain its necessary energy requirements, and ATP-dependent membranes lose their functionality. Pump membranes lose their functionality. This leads to an unbalanced electrochemical gradient and a depolarization of the cell itself. This can cause a release of neurotransmitters, as mentioned before, causing muscle contractions, and initiates catabolic processes. Things like lipid peroxidases, proteases, and phospholipidases will start degrading tissue or degrading molecules within the cell. We have an increase in cellular free fatty acids as well as free radicals, which cause damage to DNA and to other important proteins and molecules. We also have endonucleases and caspases that are activated, which start degrading DNA, readily degrading DNA, which will then initiate apoptosis, which is programmed cell death, and necrosis, which is the death of the cell. So focal or global cerebral ischemia, which is when you have a deficient blood flow, is very frequent, and that's what leads to these metabolic stresses. And also from the axonal injury, we have direct trauma to the neural cell bodies and glial cells.
Some possible causes of TBI include traumatic forces to the head, such as car crashes, falls, collisions, or assaults. Others include brain bleeding, seizure disorders, and tumors.
50% of TBIs in Canada occur as a result of motor vehicle collisions.
The best way to promote prevention of brain injuries is to stay informed. Always wear a helmet when possible. Head contact incidents can occur, and ensure these helmets are properly certified and properly fitted. Also, always wear a seatbelt when driving or operating a vehicle. Preventing brain injuries in children and the elderly should be taken very seriously. A brain injury can easily be prevented by following simple prevention techniques such as:
install safety gates at the top of stairways.
Keep stairs clear of clutter.
Install window guards to prevent falls.
Put a non-slip mat in the bathtub or shower.
Use playgrounds that have shock-absorbing materials on the ground.
Make sure area rugs are secure.
Don't let children play on fire escapes or balconies.
Install a travelator on your stairs to ensure safe use by the elderly.
Sit on safe stools.
There are 4 categories of symptoms for TBI. The first includes cognitive symptoms. This category includes confusion, lack of focus, difficulty understanding words and information, and issues with planning, judgment, decision-making, and organizing.
The second category of symptoms is physical. These include slurred speech, chronic pain, fatigue or sleep difficulties, and issues with walking, sitting, bathing, or other household tasks.
The third category of symptoms is emotional or mood changes. We can see irritability, mood disorders such as depression, nervousness and anxiety, as well as aggression.
The fourth category of symptoms for TBIs is social. This may include awkwardness or inappropriateness.
There are currently 3 methods being used to diagnose TBIs. The first is the Glasgow Coma Scale. It provides initial assessment of the severity of an injury. This allows the doctors or physicians to assess the patient's ability to follow directions, move their eyes and limbs, as well as the coherence of their speech. The second method currently being used is imaging tests. Using CT or MRI scans, an image can be received of the brain to examine its physiology. And third, it would be a neurological exam. This allows the physician to examine the patient's memory, concentration, vision, coordination, balance, and eye movement.
Therapeutic treatments are not very effective at treating primary insult injuries. The best treatment for TBIs is to prevent it from happening in the first place and to not return to the initial activity. Immediate rest and to allow limited brain stimulation is encouraged afterwards.
Susan, 24, was whipping down the 407 late for work as an intern at a real estate firm. Her supervisor, Janice, was a cold bitch and didn't take tardiness lightly. She was cruising at a firm 120 kilometers an hour and switched her 2013 Fiat 500 into cruise control, while simultaneously scarfing down a sausage croissant breakfast sandwich from Tim's. Between the time it took her to reach down and uncap her water bottle and readjust her eyes back on the road, she didn't realize that the Ford Tundra in front of her had popped a tire. The subsequent spin-out caused the Tundra to come to an almost complete stop, but it was not enough time for Susan to react. The Fiat T-boned the horizontal Tundra, sending Susan, who, in a rush, did not put on her seatbelt, sent her flying through the windshield and flew 10 meters into the grassy shoulder. The paramedics found her 11 minutes later unconscious, but breathing, with a massive laceration on her forehead. Amazingly, she seemed unscathed otherwise, but there was apparent swelling and bruising to her face and forebrain area. Her left eye was torn from the rectus muscles, leaving it popped out of the socket. CT scans revealed severe edema to her frontal lobe, torn vasculature and tissue damage, a classic sign of diffuse axonal injury. She was induced into a coma and put on a ventilator. Her heart rate and other vitals were decreased but stable. After 8 days, she regained consciousness slightly. Let's fast forward to 6 months later, and Susan has regained the majority of her gross motor movement. Physically, her body is on its way to a smooth recovery, but her psyche and mental state was another story. Susan wasn't Susan anymore. Her widowed aunt who raised her essentially moved into the hospital to be there for the recovery process. Susan could no longer speak. It was clear she could comprehend when people were speaking to her by her responsiveness. The main secondary insult was the ischemia to the Broca's area, which led to decreased function.
This was a fabricated case study to highlight some of the classic causes and results of a traumatic brain injury to the frontal lobe. In this case, Susan injured her Broca's area, which is the space in the brain used to synthesize speech. She can understand and comprehend what is going on around her, but can't connect her motor output to her thoughts. Tissue damage and ischemia led to the degeneration of neural tissue, and because of her age and lack of plasticity, this led to a poor prognosis for her recovery of speech. Susan wasn't Susan anymore.